A very good day to everyone. Welcome to our webinar today on a definitive guide on billing and payments for telemedicine. I am Diya Ranjan, Marketing Manager at Bizmatics and the organizer for the webinar today. And it's a pleasure to introduce our two panelists for today's webinar. Joining me today are Kristen Neck and Stephanie Bulgarino. Stephanie is our Vice President RCM Services at Bizmatics, and she has a wealth of experience. She has over 20 years of experience in billing and healthcare management. And her experience also allows her to give valuable feedback and individualized practice guidance to physicians. Our next presenter is Stephanie. Stephanie also has 20 plus years of experience in revenue cycle management. And prior to joining Bizmatics, she was Vice President Revenue Cycle Management at Integrated Management Solutions and Integrated Pain Solutions. So welcome to both of you today. And before we move ahead, we at Bizmatics would really like to thank and applaud all of you, each one of you, for being at the forefront of healthcare in this tough time and working hard to build a strong and safe community. We also want to tell you, to assure you that we stand with you at every step of the way and want to guide you and support you in every way possible. And we hope that today's webinar helps you to do that directly or indirectly. A few housekeeping items before we move ahead. We have a question and answer session at the end of the webinar, so please type in your questions and send them over to us. And a recording of this webinar is also available in our resource center. You can access that later on. So without further ado, let's begin the session, and welcome, Kristen. It's over to you now.
Hi, everyone. Thank you, Dia. So to start, I wanted to go over the different types of telehealth. There's three main types. One is live video conferencing. Example would be Zoom. Asynchronous video, or what's known as StoreForward, which is where the patient would video themselves and forward it to you to analyze. So it's not a face-to-face exactly. And then remote patient monitoring. The eligible providers to perform this service are physicians, nurse practitioners, physician's assistants, clinical nurse specialists, psychologists, and social workers. There are 3 new codes this year that were introduced. All of these 3 new codes are specifically time-based. You can use these 3 codes or your typical E&M codes. If you're using your E&M codes 99212 to 99215, there are modifiers that some payers are going to require that you use. There is an addition of a modifier CR that's been introduced. For example, Blue Cross Blue Shield of North Carolina is requiring that you put modifier CR because we are in an emergency or a catastrophe situation right now. Medicare's definition of this code is slightly different from Blue Cross Blue Shield of North Carolina. So Blue Cross Blue Shield of North Carolina is using this code specifically for audio only, meaning there's no video. And Medicare uses it just to define an emergency or disaster situation. We are including in this webinar some tips on the 3 new codes, one being you can only bill them once per 7-day period. And any visit less than 5 minutes does not qualify to be billed. So you need to make sure it's more than 5 minutes long. Phone consults. Phone consults are not normally paid for by your commercial payers or Medicare. Some of the commercial payers, depending on the state, have lifted this during this period, and they are reimbursing. An example would be Blue Cross Blue Shield of North Carolina with that CR modifier. StoreForward. Medicare specifically has a G code for StoreForward if that is what you're going to be doing. It's G2010. And you can only do StoreForward on established patients, and you still have to get informed consent from the patient before you can do it. Within Prognosis, there's two main things that you need to make sure are in place before you can bill these claims. The first one being you need to set up a location for telemedicine with place of service 2. And the second one is to set up an encounter type for telemedicine. I have some examples in this webinar, which will be sent to you later, of how to set up your encounter type. This section down here on the bottom right, where it says telemedicine appointment, will be enabled once you turn on telemedicine in Prognosis. So you won't be able to see it until you turn it on. And then you'll want to check that for all the visits that are specifically only telemedicine. When you're setting up the location on the billing side, again, the most important part is going to be that you have the place of service as 2. And then the address that you're going to put in the box is going to be the office's address where the doctor's sitting. We're also including a sample claim form for you. Again, with your place of service 2, your E&M code, not all payers are requiring those modifiers. Place of service 2 was recently introduced. So for Medicare, they no longer need the modifiers. They just need the place of service 2 and your regular E&Ms. When you're documenting these visits or your progress notes, the most important thing is that you have a statement at the very beginning of your progress note that says that the service was rendered via telehealth. You're also going to want to put where the patient was located, and it helps to put where the doctor's located. So the statement could be telehealth visit with the patient was located at home, doctor was located at the practice location. You want to indicate the time spent with the patient at the bottom of the progress note, and you'll want to ensure that there's still a physical exam documented. With telemedicine, the physical exam might be having the patient stand up and examine themselves. Do range of motion on themselves while you're watching, bend over, and the doctor would document while that's happening. It's also up to the doctor to decide if they have enough information to give an informed diagnosis. The doctor will also need to make the decision if they need the patient to come in to finish being evaluated in order to give an informed diagnosis. You'll want to follow the same clinical guidelines as if the patient were in person. We recommend using your templates that you would for an in-person visit. Document the same exact way. Do your HPIs. Obviously, you can't do your vitals. And do all the physical exams that you have in place already in Prognosis. Some example of services are allergies, cold and flu, diarrhea, insect bites, rashes, vomiting, post-operation check-in, and more. A lot of clinics will have the patient answer a series of questions from their portal before being prompted into the telemedicine visit that will determine if the patient needs to come in person. Example, are you vomiting blood? If the patient answers yes, they might get a prompt saying, please call the office, you'll need to come in. Can you see a new patient via telemedicine? This is state specific. We have provided a link that lists each state and their guidelines on establishing a patient-physician relationship over video. So you'll want to pull that up at the end of this and just make sure your state allows it. If your state does allow it, the most important thing to remember is you need to try to make sure the patient is who they claim to be. So you need to have a way to identify that's the correct patient that you're treating. You'll need to make sure that you can establish a diagnosis through the video chat and that the patient is covered and available to do follow-up care if necessary in your office. Payer-specific guidelines. Everyone knows on March 17th, Trump lifted the bans Medicare had in place or the regulations they had in place, which now allows you to see the Medicare patients without regulations during this COVID-19 period. Blue Cross Blue Shields are state specific. Most of them are following suit with Medicare. Most of the payers are posting this stuff on the websites now. So you should be able to pull up your state specific Blue Cross Blue Shield and get information if they're going to cover these services. TRICARE does allow it, but they follow the same referral and pre-auth as if the patient were coming into the office. Humana, Aetna, Cigna, and United Healthcare, they're constantly changing. Also, they are providing payer updates, so we recommend checking the sites daily. And then Medicaid, again, it's state specific. Most of them are following suit with Medicare, though. If you have HMOs, IPAs, you'll want to check their sites or call them and make sure that they're also following suit. With telemedicine, you can only treat patients that you are licensed in your licensed state. For example, if you have a license in North Dakota, you cannot treat a patient in South Dakota. So you need to make sure the patient is located in the same state as your license. Each state has their own guidelines on telehealth. We are providing a link that will allow you to pick your state, and it will list all of your state-specific guidelines on telehealth right now. Most of these have been updated as of March 17th. Stephanie?
Thank you, Kristen. Hi, everyone. Thank you for joining us today. My name is Stephanie Bulgarino, and as Dia had mentioned, I'm a Senior Manager of RCM Services. And today I would like to talk to you about e-prescribing controlled substances via telemedicine. As you may know, under normal conditions, you can't e-prescribe controlled substances through telemedicine. But while the public health emergency for COVID-19 is in effect, DEA-registered practitioners may issue prescriptions for controlled substances to patients they haven't conducted an in-person medical evaluation, providing all the following conditions listed here are met. A prescription is issued for a legitimate medical purpose, the use of appropriate telemedicine communication systems, and the practitioner is following federal and state law. I would also like to mention the DEA has posted information on its website stating that it will not enforce restrictions on prescribing controlled substances via telemedicine during the national state of emergency related to COVID-19. Next slide, please. You may be wondering, how do I know if my state will allow me to e-prescribe controlled substances? Well, each state's rules regarding e-prescribing via telemedicine are different and changing while the public health emergency is in effect. We recommend you contact your state medical board to find out what their position is at this time. Some state medical boards' websites are posting the update of information, so this is where I would start. Next slide, please. One more thing to consider when implementing telemedicine is informed patient consent. Some states may not require informed patient consent, but it is recommended as best practice. Here we have some examples of what you should include on your consent. We've also included a link on our resource page to check the requirements for your state. Next slide.
We have a
Here's
list here. Sorry, this list will be sent to you guys of the resources that are listed in the webinar for all of you that will link you to your state policies. And then just as a final comment, most of these updates are related to the current situation that we're in. That being said, once the COVID-19 crisis is behind us, this may not be the same guidelines. Payers may go back to what they were before. So just keep that in mind.
Okay, and I
Dia,
think
do we have any questions?
Yes, we are now open for question and answers. I thank you so much, Kristen and Stephanie. I think we were wanting to let our audience and our customers know about billing and payments, and we try to do it as quickly as possible. And I hope the information was helpful. We do have a few questions, and Kristen and Stephanie, I wanted to tell you some of them are generic. And at this point, I also want to let everybody know that we have a telemedicine webinar coming up on Monday. So please look out for the details. We should have them out for you soon. That telemedicine webinar will cover a lot of your generic questions, but I do have a few again. From people in today's webinar. So Kristen, here are them. I'm just reading to you, and then you can answer them. So the very first one is more like a generic question, and the question is, how long does it take to turn on the telemedicine functionality for a provider?
So what we recommend is the first step, you're going to want to set up your Zoom Pro account. Once you have the credentials for your Zoom Pro account, you'll want to send that to either your implementer, your client manager, or tech support. After they receive your credentials, it's 1 to 2 days to turn it on.
All right. So the next question is, do you know what the specific guidelines are for speech language pathologists? I don't see them listed in the initial list of providers eligible to bill through telemedicine. I don't know, Kristen, if you would want to pull that list, or do you know
I can pull the list for you. A lot of regulations and restrictions have been lifted during this period. So for speech, I can send them and include them at the end when you get a copy of the webinar. If you want it to be your state specific, if you just let us know which state you're in, we can include that for you as well.
All right, we are getting a lot of questions, and the next question is, what codes are you referring to when you mention telephone consults being paid by some providers?
So the telephone consult codes are, let me just go back up to that slide for you. These are the set of those consult codes. So it's the 99441 to 99443. They are time specific. And you will want to make sure you use modifiers for these codes. And then make sure which payers are reimbursing right now and which payers aren't.
All right. So the next question is also, what is the effective date of all the special codes, especially for Medicare?
So the brand new codes was January 1st of 2020. Your regular E&M codes that you can use, which are the 99212s to 99215s, those didn't change. You'll just need to make sure if you're going to report those codes, the place of service to is very critical.
Okay. The next question is, can you show the slide again with the modifier screenshot again? So can you just pull that up again?
Yes.
And as we're doing the Q&A, I also wanted to, again, specify that we would have the PowerPoint slides available for all of you in a resource center. So you can go and access that again after the webinar. So yes, so Kristen, again, we have another question. We have 3 different offices. Do we need separate addresses in billing setup?
Yes. If the doctor is going to be at the 3 separate offices. So you'll want in box 32, when you set up your location, the address is going to be where the doctor's sitting. So if you have 3 locations, but the doctor's going to stay only at one of those locations, you'll want to put that one location that he's sitting at.
All right. So the next question is, do you know which payers are paying for telephone consults after hours call, etc.?
It is state specific. A lot of them don't. Blue Cross Blue Shield of North Carolina has posted something on their site saying they will, again with the CR modifier. So I do definitely recommend pulling up each payer's website, and they have specific updates right now about the telemedicine and which services they'll pay for.
Okay. So the next question is the modifier same for 99213 and 99443?
So the 99443 code does not require one of these modifiers. Unless you're in North Carolina and you're doing the Blue Cross Blue Shield, it requires the CR. The only codes that require these modifiers are your 212s to 215s.
Okay. How does Prognosis help to determine the level of telehealth encounters since we are not coding for a physical exam?
So you still want to make sure that a physical exam is being performed. That's why you have the option of doing either the brand new codes, which is the 99421 to 423, which is purely time-based, not based on physical exam. If the provider is going to do the physical exam with the patient, again, most of that would mean the patient is examining themselves, would be 99212 to 215. So depending on what the provider's doing, he would have to make that decision.
All right. So the next question, do you know any average reimbursements for visits?
Yes. So right now, especially if you bill the 99212 to 215, they are paying the normal rates. And even some of the payers like Medicare, they're waiving the patient responsibility portion. So they're covering the copays. Each payer has it listed on their website if they're gonna do that, so that the office knows that they don't necessarily have to collect from the patient.
All right. So this question is regarding the links. Which link talks about the state restrictions for new patient visits, if they are allowed?
So it is the one, there is a slide that you'll be given that says, this one, can I see a new patient via telemedicine? This link right here from AMA is the one you're gonna wanna click. And then that will link you to, it's a PDF file, and each state is listed. So just find your state and it'll say yes or no what the requirements are.
All right. So is the place of service on the claim, so the place of service on the claim form, would that be the patient's address if they were at home?
No. No. Place of service is going to be where the physician is sitting. And then your place of service code is 02, which indicates that it was done via telehealth.
All right. So, and so there's somebody who's asking, so there will be no PE with 99441 or 994433.
So what I can do is send you included in this a differentiation between the two, so you'll know when to use the new codes versus your E&M codes.
All right. So the next question is, so if it is considered as an emergency, would you use modifier CR for Medicare?
Yes.
Okay. And will California workers' comp pay for telecommunication visits 99212 and 99215?
So a lot of them right now are lifting their restrictions, again, because of the situation that we're in. So a lot of regulations and the payers are lifting that. It is payer specific. When March 17th, when the president went over the lifting, he recommended that everybody follow suit. It is payer by payer. Most of them have followed suit though.
Okay, all right. This is again more of a generic question. What modes of communication can we use for video when doing telemedicine?
We strongly recommend Zoom Pro or a HIPAA compliant video. So synchronous is video. The asynchronous is where the patient would do like a StoreForward or like videotape themselves and then send it forward to the doctor.
All right. So the next question is, do we need to request prior authorization for telemedicine?
From some payers, yes. So like example, TRICARE, the same way you would if the patient was coming in, you have to do it for the telehealth.
Okay, all right. So the next question is, how much does it cost to set it all up?
So the cost right now, Prognosis is offering 3 months free on the telemedicine. The providers will have to pay for their Zoom Pro accounts though, and that's about $14.99 a month. So if you sign up today, you would get the 3 months free and you would only have the $15 a month cost.
Okay. So the next question, how do I know which codes to use? This is more like an open-ended, but yeah, how do I know which codes to use?
Okay, so when we forward this, I will include the two differences to try to help you decide which code the provider would pick, either the time-based or evaluation and management-based. That should help. You can use it as a cheat sheet while the doctor's seeing the patient to determine which one's more appropriate.
Okay. So if you are doing audio and video, do you still use normal EM code 99211, 99215 and use 99441, 99442, 99443 only for audio? And let me know, Kristen, if you want me to repeat this question.
So yes, the 9944 series is audio only. So only if you're on the phone with the patient. If you're doing the video and you can see the patient, it's live interaction, then you would pick your regular E&M codes or the brand new codes, the 99421 to 423.
Okay. Can you please elaborate on the CPT code G2010?
Yes. Let me pull that slide back up for you. Here we go. So this is what they call StoreForward, meaning let's say the patient is an established patient, they have a condition, the office asks them to record it. They would record the symptom or the rash, record themselves answering some questions, and then that would be forwarded to the doctor. The doctor would review the recording and then make a decision, and then treat the patient based on the recording. So there's no live interaction.
Okay. And Kristen, can you please show the slide for things to add in progress note? Maybe you can go over that again.
Yes. So in this slide, again, the most important thing is going to be the statement that the service is telehealth or over video. Make sure you mention the location of the patient, if they're at home, at the hospital, if they're in a skilled nursing facility. So make sure to indicate where the patient's at, and then indicate the time spent with the patient at the bottom of the progress note when you're complete. And then document the physical exam. So if the patient is examining themselves, you would just document that. If you're having them do their range of motion, you would document, what the patient was doing. And then just make sure that you're able to give an informed diagnosis based on that video interaction. If you do need to stop it and tell the patient you need to come in at this point, make a note of that in your progress note, that the video was ended and patient was advised to come into the office. And then we recommend following the same as if they were in person. You don't want to document less. So even though it's over video, you want to make sure you're not just writing like a 4-page progress note. You'll want to make sure you're documenting. Not 4-page, 4-sentence, sorry.
All right, few more questions, Kristen. So the next is, when or do I have to use the 95 modifier?
No, not all the payers are requiring that. Example, Medicare doesn't require modifiers anymore. The place of service is the most important piece now, the place of service code.
All right. I think we do have a lot of questions. So let me just pull one. Can you bill for a video that had to be stopped due to patient being physically seen?
It's going to depend on payer. I can put the most common payers guidelines on that in this webinar that you're sent at the end of this. So I can pull what like Medicare says about stopping the video. It does ultimately depend on when you stop the video too. So you want to make sure that you're at least, you can't bill for anything under 5 minutes.
Okay. So does the place of service code has to be office or can it be a non-office location?
Place of service code has to be 02, which is specifically telehealth. So do not use place of service 11.
All right. Let's take this question. Will Medicare reject if the modifier is used?
Yes. Medicare no longer requires the modifiers, so if you add the modifier to a Medicare claim, it could result in denials.
All right, and we do have a lot of questions coming. I'll just take this last question. I would encourage everybody to send over their questions, and then we can actually put that all in an email and send it to everybody. But in the meantime, let me just take this question. If you just have a phone conversation with RX, do you use G2012?
No, because that G2010 or 12. Sorry, what'd you say, Dia?
G2012.
On the phone, you're talking to the patient specifically about refilling a prescription?
It just says a telephone conversation with RX. So you
With
maybe
RX.
one or two. Yeah.
Could you just type in the chat box, be more specific for me? Is it like you're providing a phone consult and then prescribing, or it's just a prescription refill call?
So it's actually refilling a prescription. I just got that.
So you can't bill for just refilling the prescription. If they're like consulting the patient and then refilling, they would do the phone consult code.
Okay.
So I guess it depends on what interaction happens during the phone call. Like if the patient's just calling saying, "Can you refill my meds?" You typically don't bill for that.
All right. So let's take this last question, Kristen. Can you repeat the billing codes for synchronous telehealth visit again, please? So maybe you can have that up and.
Yes, so the synchronous, you have the option of the new codes, 99421, 422, 423, which are specifically time-based and for established patients only. I just want to clarify that these codes are not for new patients. Or your regular E&M codes that you would use if the patient was in person.
All right. So I do have a lot of questions, Kristen. I will send it over to you. And then,
Okay.
yes, and as we decided, maybe you can let everybody know that we will have it over in an email, put all the questions and answers together and send it so that everybody can get answers to all the questions asked. So
Yes.
saying that, yeah, thank you so much, Kristen and Stephanie, for your time and for this insightful webinar. I think our viewers would have benefited from this. I also wanted to let you know again that we would have the slides, the PowerPoint presentation and the recording on our resource center. So you can access it once again. And I would like to thank all our audience for taking out the time to be with us here today. We do have a webinar again, as I said, on telemedicine on Monday. So please stay tuned for more information. Thank you from all of us here. Bye.
Bye.
Bye.